My name is Dr. Tracy Capes. I'm a urogynecologist here at Aurora Women's Pavilion, and I'm involved in a project called A Stitch in Time. And basically what it is, it's myself, two other general OBGYNs who work out of a hospital in Queens, New York, as well as a nurse midwife that also works in New York. We met during my training and had a strong interest in women's health around the world, and particularly in providing health care to women in remote areas. We started out, just the four of us, actually collaborating with an NGO in Bangladesh. Have been going there for the past 4 years and providing care for women there, particularly with problems of prolapse. We now are expanding our group, and we are looking at expanding to Guatemala, and have just done several trips down there to kind of set up the logistics of going on a mission again in November. The purpose of our group is to provide care to women in remote areas who otherwise would not receive care, and particularly women with prolapse. This is a problem that even in our own country doesn't receive a lot of attention, and these women, it's not something that they talk about there either, and it can really inhibit their daily lives. Not only do they have this feelings of pressure and heaviness, but there are times when their partners or their husbands accuse them of adultery because of the prolapse, and then subsequently results in divorce. So it's quite a problem not only here, but in many areas of the world where women have no other access. Obviously, there's many differences between the healthcare that's provided in these remote areas and then here in the United States. I think there's two things that stand out. One is the distance that these women have to travel in order to receive care. They, for example, in Bangladesh, have to travel several days to even get to where we are providing the care for them. And we are doing our work in the northern aspect of Bangladesh. There's a huge river, and these women live on chars, which are islands that change over time. So not only do they have to walk, but they many times have to take several boats over several hours just to get to where we are, which, as you can imagine, can be expensive for them, and the family has to come together in order to provide the money for them to get there. So one of the things, and that's the point of our group, is to provide care for these people with out access and that are in remote areas that other people don't go to. One of the other, I think, striking things for me, the last time we were in Guatemala, we were doing a surgery, and the women's blood count was quite low prior to surgery. And so here in the United States, we would just assume that she could get a blood transfusion if need be, and there's a blood bank. But in Guatemala, at this hospital that's in a remote village in the mountains, there's no blood bank. So we had to tell the husband to go out and find donors who would be willing to give blood for his wife prior to her having surgery, so that in case anything happened, she could receive a blood transfusion. So those are several things that we take for granted here in the United States, that we can get in a car or even get in a bus and go, a couple of minutes or even an hour to get access to excellent health care. In addition, that when we get to that place that has health care, that we will have access to all the secondary and ancillary services that we're accustomed to. It's very different in the developing world. So we've been doing work in developing countries for a number of years, and I think one of the most striking things is that when I come back, I realize just how lucky we are to be here in the United States, that many of us have health care and that we have access to all of the radiology and the ancillary services, in addition to all the amazingly trained physicians here. That's not something that everyone has, and I think that we definitely and unfortunately take it for granted. The purpose of our group, again, is to provide excellent care to women in these remote areas that otherwise wouldn't have that access. For example, if you want to get involved with our organization, it's about $300 to provide one surgery for a woman. That includes her transport, it includes her access to the surgery and the care afterwards. And so that's just one way, at least to help our organization to understand where the money that you would donate would go to. If you're looking at, we're just one organization of many that provide excellent care throughout the world. I would definitely encourage you to do whatever you can, whether it's to help someone promote through charitable benefits. Find out a lot about the organization before you start and what their overhead may be, who's all involved, where they've had their training, and how much they know and are involved with the culture and training of the physicians at the places they go. For example, we're not trying to go in and just provide surgery and leave, but we also work with the physicians and nurses who are there in order to make everyone have a sense of responsibility towards the care and involvement towards the patients that they're taking care of in their own country. I think what we do is wonderful work, and I would encourage everyone to get involved as you can.